So hello everyone, my name's Tom, I'm one of your practical skills tutors.
And I'm Tina, another one of your practical skills tutors.
And what we're going to do today is we're going to start this video. It's going to be a set of videos outlining how we measure and record a patient's vital signs. Vital signs recording is one of the most basic forms of assessment of your patient. It forms of 5 different vital signs, 5 main vital signs: respiratory rate, saturations of oxygen, temperature, blood pressure and heart rate. It can be used in all sorts of clinical areas, from your GP practice to in hospital, in ITU, in the emergency department, or just on the wards. The frequency with which you record them can vary depending on your place, so it might be yearly in the GP practice, it might be 4-hourly on the ward, it might be continuously in ITU, and the different vital signs can vary slightly depending on where you are. So for instance in ITU they would include things like CO2, central venous pressure, all those different things. But we're going to focus on the 5 main types. The 2 we're going to talk about in this video are respiratory rate and temperature. So if we talk about respiratory rate first, what that is the amount of breaths a patient takes within 1 minute. It is one of the most important vital signs that you can record for a patient, because it is the vital sign that changes the quickest and the easiest if your patient is deteriorating or if they are indeed improving. So we really want to make sure we get an accurate rest rate, but because it can be slightly laborious to take and it can be a bit awkward to take, because you take over a full minute, it can be something that people sometimes do wrong, or they can be they can cut corners really when they take it, they can rush, yeah. So we want to make sure that we teach you it in the right way. So if we're going to record someone's respiratory rate, we need to be able to observe them breathing over a full minute. And so if we then said to the patient, right, I'm going to record your respiratory rate or observe your breathing over a full minute, so obviously you might be aware that the patient can alter their respiratory rate. So they can breathe faster if they want to, and they can breathe slower if they want to, or they can be more deliberate about their breaths. So we want an unchanged respiratory rate, what their actual respiratory rate. So it might be a vital sign that we might do covertly. So we might decide to write some of their observations down, or input their observations in the computer, and then observe the respiratory rate as we do that. We might get someone else to do the respiratory rate for us while we do other things. We might busy ourselves with the observation machine that we're going to show you later, and then record their respiratory rate. Or a common practice, which is a recognised good practice, is to actually pretend-ish to record their pulse rate. So we might pretend like we're recording their pulse rate and then actually record their respiratory rate over a full minute instead. We can then go on to record a pulse rate over a full minute if we want to, so it'll take 2 minutes in total. That's a really good way, but there are some other problems with recording respiratory rate. So one is that we don't particularly want to be staring at the person's chest. It gets a little bit awkward if you're there silently staring at them. So we want to make sure we do it in a way that doesn't make the patient feel uncomfortable. So people might do it using their peripheral vision. They can sometimes rest a hand on the patient as they're doing the pulse. They can feel. They sometimes just listen, because sometimes you can just hear someone breathing. And there's all sorts of ways that people have to do that. But as long as you don't make the patient feel uncomfortable, that's a good way. Also, that some patients don't always use their chest to actually breathe. Well, they use their chest, but they don't move their chest. They might move their tummy, they might move their shoulders, and sometimes when you're looking you might not see any movement. Plus also if they're wearing loose clothing, you might not be able to see what's going on. So you need to be able to look at the place where they're actually moving the most, and also if you can't see them, you need to get them in a position where you can actually count. So you might ask them to sit up, or whatever you need to do to be able to actually count that respiratory rate. Once you've counted it for the minute and you've got the time, you can then note that down, or how many breaths they've taken, note that down, and then you've got your recording. Other things that you can look at when you're actually recording the respiratory rate is the depth of the breath. So is it short, shallow breaths? Is it great big, deep breaths? What the patient's positioning? Are they bracing themselves? Are they leaning forward? Can they lie flat comfortably? Is the chest expansion good? Is it small? Is it equal? So is one lung moving more than the other? Is there a pattern to the breathing? So 3 breaths, then a long pause. Or if they're indeed got pursed lips, so they're breathing as if they're really panting, or can they complete a full sentence, or do they have to stop to take breaths in between words of a sentence. So those are all important things to think about as you're actually recording respiratory. Anything I've forgotten?
No, that's it.
Okay, so that's respiratory. So what we need to do is one of our signs needs to be respiratory, so we need to count their breaths over 4 minutes using all those different methods. The other vital sign we're going to talk about in this video is taking someone's temperature. So obviously we need to make sure that we record someone's temperature accurately. There's all the methods out there which I'm sure you've seen, so the glass thermometers under the tongue, we don't use mercury anymore, but whatever they use, under the armpit, the plastic strips you put on children that say the temperature. You must have had your temperature recorded with an infrared thermometer as you're walking into a shop or a restaurant. Two favourite methods in hospital are the temperature probes that we can put covers on, put under, and you'll see that they don't use them in Western Hospital, but you'll note that in vital signs that we teach you, in all practical skills that we teach you, we're going to teach you lots of different methods that aren't necessarily used at Western Hospital because they might be methods that you use in other hospitals. So at West Suffolk Hospital, we tend to use tympanic thermometers, which are thermometers that you can place inside the ear and they'll look at the tympanic membrane of your ear and they'll be able to record your temperature. So most tympanic thermometers are, so the ones we have are attached to Ops machines, which we'll show you later. But this one, for example, when you pick it up, it actually looks like it's turned off and the screen is blank. There's a few buttons on it with a great big triangle button, which is the button going to take the temperature. And inside the actual box that it comes in are covers that when you put one of these covers on, will activate the thermometer and turn it on. Before you take the temperature of the patient, you can ask them which ear they prefer you to use. You'd also make sure the ear's clean and there's no discharge or inflammation. Also make sure that your machine is in good working order, that it's not like a wire sticking out of it or it's leaking somehow or covered in mess. Once we've done that, we also need to think about have they had something that's been covering their ear, so like a hearing aid or something, because if they take it off, obviously the ear will be slightly warmer because it's been insulated, so we need to make sure we take that away and let the ear to air before we actually take the temperature. So if we are going to take temperature, we can place our cover on our thermometer. When we do that, the thermometer turns on, and then what we need to do is be able to just take the ear, brace the patient, put it out and up, place it into the ear hole, and then we're going to press the button on the thermometer and we can take it out, and then on the thermometer we can actually see the actual temperature of the patient. Once we've done that, we then need to get rid of the cover, which we can just aim at the bin or wherever the covers go, and then get rid of the cover, it just fires off. So you don't throw it on the floor, that's just what we do for dramatic effect. And make sure your machine is decontaminated afterwards, so give it a good clean wipe. The other method that you might see at Western Hospital is this temporal artery thermometer. So this is a thermometer that looks at the temporal artery going across our face and then behind our ear to see what the temperature is of the patient. For this one, again, make sure the machine is all clean and dry and working order. And also make sure your patient doesn't have any wounds or anything you're going to wipe the thermometer through. And for this one, there's a big button on it, so we want to make sure that we can move any loose hair out of the way, press the button, place the thermometer in the middle of the forehead. We can hear that there's fast pips, that means it's collecting information. Follow the temporary artery to the ear, keep the button depressed, place it behind the ear and release the button, and that gives us a recording there. So once we've done that, we can we don't have a cover on this machine, so we don't need to get rid of that one. We need to give it a clean, and then we can place that down, and we also need to record what that temperature is. Make sure the patient's comfortable, and make sure they're if they haven't got any questions, and then that's it. Okay. So our next video will be on pulses and SATs, and we're also going to introduce you to our ops machines. Thank you very much.
Thank you.